Hello, so I am going to go over some newborn adaptations, normal anatomy and physiology of the newborn. I'm going to go over respiratory, circulatory, thermoregulation, and glucose regulation. I do have my book here just as a reference, just to make sure I stay on track. Respiratory changes that happen in the newborn. Obviously, when the baby is the amniotic fluid, the lungs are full of fluid also. So there is there's a surfactant is what coats the alveoli, which is inside of the lungs, and that's what matures the lungs. So sometimes if there's a reason that they think that a baby will be a preterm baby, they will do an injection of surfactant to kind of mature the lungs sooner. But when the baby is born and they have the reflex to take the first breath, that creates it pushes the alveoli fluid to the extremities of the lungs and fills the lungs with air, which, well, typically that's what happens. You want the clearance of the fluid, the lung expansion, and the circulatory changes is what causes the pulmonary perfusion. So that's what causes the baby to be able to breathe. All of that fluid will get pushed to the edge of the lungs, and that just goes through the lymphatic system. So it gets removed from the baby's body that way. If there is like a mucus in the nose that the baby's unable to get rid of it on its own, it's suggested that you do a little bulb syringe to get that. And also another way that the baby gets rid of all that mucus and amniotic fluid is by means of a vaginal birth. There's a squeeze on the thorax, so like on the baby's chest, and that squeezes out some of the fluid. The cesarean babies don't always have that opportunity. Next, we would be, and also a normal newborn respiration rate. So like how many breaths per minute a baby's taken is about 30 to 60. That can vary if the baby's crying or upset, but if you're listening to the baby or you're holding their pulse to feel their pulse, it should be between, or not pulse, I'm sorry, respirations. If you can put your hand on them and just count how many times they're taking a breath, it'd be 30 to 60 breaths per minute. That's normal for a baby. For circulatory changes, that's talking about the blood flow for the baby. Most people know, that the placenta is what's feeding the circulatory system of the newborn and removing waste from the newborn. So there are 2 arteries and 1 vein, typically in an umbilical cord, and the vein is taking oxygenated blood to the baby, and the 2 arteries is removing that. There's 3 different shunts in the heart of the baby. A shunt is like where blood flow is being moved from one place to another. And there's 3 that are physiological in a newborn or in a fetus that close soon after birth. Those are the foramen ovale, the ductus arteriosus, and the ductus venosus. Now, I know those are like a lot of medical terms and things like that, but when the lungs are being developed, they do not need as much blood flow as a adult. So there are these adaptations, which are the shunts to shunt away some of the blood flow to the lungs. And then also the liver, because the placenta is what is cleansing the blood, of the newborn. Once the placenta is gone or clamped, then the liver needs more blood flow. So all of those shunts keep those lungs, they don't provide as much blood flow until after the baby's born. Then they start closing not long after the baby's born. So yeah, that's part of how the circulatory system works. And a normal heart rate for a baby is about 110 to 160. It can be a little less if the baby's sleeping after birth. It can be as low as 80, but typical is about 110. So thermoregulation, that means how the baby is keeping its body temperature, basically. Babies are not born with a lot of brown fat, or I'm sorry, without a lot of adipose tissue, which is like, fat that humans have on their bodies. So it can be more difficult for them to regulate their temperature. They do have what's called brown fat, and it's very little, but that is one way that the baby will maintain its temperature if there's a reason for it to be stressed with by its temperature. So there's 4 ways that the baby is can lose heat: convection, conduction, radiation, and evaporation. Basically, those are all 4 ways that the baby can lose heat if it's touching something cold, if the baby's wet. So you definitely want to dry them as soon as they're born, and if you're giving them a bath, like, you want to keep them as dry as possible. The room temperature obviously can have an effect. And the quickest way to warm up a newborn is to place them skin to skin, typically with the mother, but it doesn't have to be the mother. That is the quickest way to conduct heat and thermoregulate. So if this baby is having thermoregulation issues and you need to warm them up quickly, putting them skin to skin is better than just bundling them up and putting them under a heater. So that's definitely what you'd want to do. And sometimes babies who can't thermoregulate or are having a hard time will show signs of respiratory distress, which is like nasal flaring, retraction of the sides right here. So if you're seeing those types of symptoms, the first thing that you definitely want to do is get the baby warm. You typically don't see a baby shivering because that means that the baby is like hypothermic. It would be an extreme situation where that baby would shiver. So in that situation, it would be crucial to get a baby warm. Let's see. And also I wanted to mention non-shivering, but having some type of muscle activity, or they are going to use that brown adipose tissue or the brown fat quicker, which can lead to glucose issues, which is what my next topic was going to be, glucose regulation. Prior to the birth, the glucose regulation is through the mother or through the birthing person. So, they don't have to regulate their own glucose, because they're getting everything through the umbilical cord. So after the baby's born, I know there are certain risk factors for babies to be hypoglycemic, meaning like they are having a glucose dip, and that would be, some of those risk factors would be if it's a smaller than normal, an IUGR baby, a baby that's larger than normal, large for gestational age. What else? Let's see. All of those are things that could potentially make the baby have a harder time processing glucose. And so with those babies, you definitely want to get them to breast as soon as possible if that's what the parent is choosing to do to feed the baby, or, supplement or whatever. The blood glucose levels are going to drop right after birth, so you definitely want to get them to eating immediately. And then, if they do not take in glucose, then the baby is going to use glucose through its liver stores, which this is going to cause hypoglycemia if the baby is using more glucose than it's taking in. So definitely something that you want to pay attention to, and you may have to do like a glucose stick if you see that a baby is like lethargic, or if the baby's like showing jitteriness or something like that, like you definitely want to make sure that that baby's getting something immediately, and it may even lead to a little bit of supplementation right at the beginning in order to make sure that that baby doesn't have a drop in glucose and use the adipose tissue and glucose stores. That's about it for those 4 adaptations. Thank you.